Would you consider your work trauma informed? And if yes, how do you think this ties into the grief and loss aspect of your work?
Well, see, trauma was a central part of Freud's own thinking, right from the beginning. And he had changing experience around trauma. Originally, he practiced a kind of abreaction therapy. That is, the patient would re-experience the trauma and weep and rage and re-experience the traumatic events, and then he found that that really wasn't working so well because the old defenses come back into place. By the 1920s, he was seeing all neurosis as made up of defensive maneuvers against experiencing traumatic anxiety. We build up defenses to avoid the trauma of being attacked by our superegos.
Hmm.
That's guilt. Being, we often are in a situation we realize, oh, I better stop this, otherwise my superego is going to attack me. Or I better stop this because if I keep this up, I'm going to get, quotes, castrated,
Hmm.
attacked, unmanned. Um, um, I better stop this because if I don't, I'm going to lose her love. I better stop this or I'm going to lose her completely.
Hmm.
No, these are all traumas I'm wanting to avoid by going into defensive maneuvers of some kind. So trauma has always been there in Freudian theory. Now, in the last several decades, we have this offshoot where people become trauma experts or experts in trauma therapy. I don't think too much of this, frankly. I don't think you should take one part of the, the, the troubles of the soul and make it into a specialty. I think we all have to learn how to deal with trauma. I think every therapist who works in depth with people is going to be doing trauma therapy to some degree because people are traumatized.
Absolutely.
So yes, I do trauma-informed work, but I would never consider myself a trauma therapist. I'm a psychoanalyst who, like all depth therapists, has to deal with trauma because trauma occurs.